Hey guys, it's Hina Sheth here at Rebalance Physical Therapy, and I want to talk to you guys today about what is the pelvic floor, what are these muscles, what happens when these muscles are dysfunctional, and what can you kind of do about it. So I basically, in order to explain this, I have to show you a model of the pelvis. Now this right here is a model of the pelvis. These are your two bones, okay, which are your pelvic bones. In the front, they connect together to form the pubic bone. And in the back, they connect onto another bone that kind of looks like a cobra head called your sacrum. And at the bottom of that sacrum is your tailbone. So all these bones are interconnected together. And you have your hips that come out from the socket of the pelvis. And then you also have your spine, which basically starts above that cobra head and it goes all the way up. So you can see how the spine, the pelvis, the pubic bone, as well as the tailbone and the hip are all interconnected together. So if you have any issues originating in your spine, in your hip, in your tailbone, and you're starting to experience a lot of these symptoms that you may have clicked on this site to see, try and get some answers as far as what might help, this is how things can kind of be interconnected. So obviously, if there's something wrong and all of this is interconnected, there's something wrong in any of these areas, it's going to also affect the musculature in and around these areas. And one of the muscle groups that connects directly into the pelvis is called your pelvic floor. And this is all this red muscle that you see inside of this pelvic cavity. Okay, and if I flip it underneath, and you can see again that this is the pubic bone, and there is your tailbone. All this red that interconnects from the pubic bone to the tailbone as well as out to the sit bones, this all right here is your pelvic floor. And most people think it's one muscle, but it's actually not. There's 16 plus muscles in this pelvic floor group. And this is the same for men and women. The only thing that's different is, some of the structure, the sexual anatomy in terms of a penis and a vagina. But everything else is the same, very, very similar. I don't want to say exactly the same, but very similar between a man and a woman. So these muscles, just like any other muscle groups in the body, can become either really, really weak or they become really, really tight. And most of the time, if you're suffering from any type of pain situation, most of the time it's because this musculature has become tight. And it becomes tight for many different reasons, but it can definitely involve if you've had any hip issues, tailbone issues, pubic bone issues, low back issues in the past. Maybe, after you've had a baby, you're starting to experience symptoms, or maybe you've had a lot of stress in your life and that maybe tightens some of these muscles up. Maybe you had some sort of injury and that kind of escalated to now you're feeling these symptoms. And what can these symptoms be? Well, for men, it can be everything from rectal pain to scrotal pain, penis pain, testicular pain, feel something like fullness in the prostate or fullness in the rectum. It could be something called, maybe you've been diagnosed with a nerve condition called pudendal neuralgia, and this can happen in women as well. And that's because there's lots of nerves in this area. One of the big nerves that come out is called your pudendal nerve, and if these muscles are tight, they can compress on these nerves and give you saddle type, potentially numbness, pain, shooting pain into these areas. Some people often will go and see their colorectal doctor because they think that their hemorrhoids are causing their pain, but most of the time hemorrhoids are not the issue. They are not the things that are causing pain. It's usually because there is change in this musculature and it's radiating pain in very different areas. And for you women, you guys can have lots of different aches and pains, including vaginal pain, pain with intercourse, pain with urination. Again, men can have this too. You can have urinary hesitation or retention, or it feels like your bladder isn't completely emptying. Again, this can happen with men. You can have prolapse issues that sometimes start because of too tight musculature, constipation, IBS. Again, you men can also have constipation, IBS. For some of you women who have bladder conditions where you're going frequently to the bathroom or you're having bladder pain, something called interstitial cystitis. Again, often in women, but men can also suffer from this too. So these are just some of the things that you might be experiencing if you have tightness in this area. Now, what can be done about it? Well, obviously, this is where highly skilled intervention is involved with this, and this is what we specialize in, is the hip, the spine, and the pelvis. It's kind of like our bread and butter. This is what we do all the time, and we have over 60 years to combined experience treating this condition. Actually, I want to say over 70 now that I think about it. Anyway, so you have to get this musculature under control, okay? You have to relax all these muscles. There's different techniques that we do to work both internally on these muscles as well as on the outside to balance all the musculature and all the joints out. Because if your joints are not in balance, including your spine, your pelvis, and your hip, and your tailbone, then this musculature may not calm down. So this is ultimately what needs to be done. And I don't want to get into all the nitty-gritty of these things. This is what an evaluation with us is for. But I hope that at least explains what might be going on. And maybe you guys are frustrated from seeing healthcare provider after healthcare provider and not really getting any answers. Maybe some of you have already had treatment for this condition, either being seen by a chiropractor, or maybe you've gone to another physical therapist and you haven't seen results. We're a little bit different, as you can see by this site. You know, we're very holistic. We truly believe in integration of treating a lot of these conditions. And you know, this is where this is probably the last stop for most people. So I hope that's been helpful. If you have any questions, feel free to contact us on this site and fill out to see if you are eligible for a free phone consultation. And I hope to see you soon and hope to get you better soon. Thanks.